So I did my project on the gluten-free diet and celiac disease. I decided to choose this topic because I was diagnosed with celiac when I was 2 years old and have been on a strict lifelong diet ever since. My research question is, how does a strict gluten-free diet affect one's body with celiac disease? So celiac is an autoimmune deficiency that affects the small intestine. When gluten is digested, the body sees it as an attacker because people with celiac have damaged villi, and these villi absorb nutrients. Celiac is not a very common disease. It is estimated that 30 to 40% of the population has one or both of the genes that are linked to celiac, but only 1% actually develop the disease. So there is no cure for celiac. The only treatment is a strict lifelong gluten-free diet. Celiac can be triggered by environmental factors and is also hereditary, although it does come in clusters with families, so there's no way of knowing which generation will actually develop the disease. It's also hypothesized that it can be triggered by illness, trauma, and puberty, along with every other autoimmune disease. If a strict gluten-free diet does not begin after diagnosis, patients can develop anemia, malnutrition, infertility, cancer, and any other autoimmune deficiency. All gluten-free foods consist of foods avoiding wheat, rye, oats, barley, and malt. It's much more difficult finding foods like that, but in this time, it's become much easier. So, one article I found was gastrointestinal symptoms in celiac patients on a long-term gluten-free diet. This study focused on the testing of how long-term gluten-free diets affect the gastrointestinal tract of those with celiac. Patients were separated into a short and long-term group. The short contained 128 people, and long-term was 635 people. Their symptoms were tracked to determine if the difference between short and long-term gluten-free diets affected the gastrointestinal tract. 93% of the short and 94% of long-term groups had a strict gluten-free diet and discovered mucosa. There were no differences in symptoms between short and long-term gluten-free diet patients, although long-term patients did have more reflux and showed mild symptoms. But both of these results were compared with IBS and IBD patients. The second article that I found was latest in vitro and vivo models of celiac disease. This study focuses on these models of celiac in order to understand the pathogenesis of celiac disease. So during animal testing, dermatitis was found on the monkey but normalized after the start of the gluten-free diet. ALV-003 retains enzymatic activity in acidic environments, for example, the stomach. I found that 300 milligrams of ALV-003 is safe for those with celiac. It was recorded that those with celiac can actually break down at least 1 gram of gluten. Helminths and probiotics are potentially new effective therapy for celiac patients. A quote I took from this article was, use of vitro and vivo models, including CACO2 and IEC6, intestinal biopsy cultures, spontaneous in vivo models, induced models, and transgenic models have allowed an understanding of pathophysiology of this disease and new therapies for celiac. So for the spontaneous vivo models, they use dogs and monkeys. Induced models are rats and mice, and transgenic models are just mice. The monkey developed antibodies focusing on epidermal The antibodies focus on epidermal transglutaminase and tissue transglutaminase. The last article I found was health benefits and adverse effects of a gluten-free diet in non-celiac patients. Gluten-free diet for celiac patients can be harmful and beneficial at the same time. Gluten-free products are 242% more expensive than regular products. Gluten-free products lack fiber, folate, iron, niacin, riboflavin, and thiamine. Gluten-free diets are necessary for patients with celiac, but this does come with a cost. For example, these harms can include macronutrient deficiencies, increase of fat, hyperlipidemia, hyperglycemia, and coronary artery disease. These patients are now at a risk for new deficiencies, financial decline, and mental health issues. In conclusion, gluten-free diets are both beneficial and harmful to those with celiac, although at this point there is nothing that we can do about it because it is the only treatment and there still is no cure for it. Taking supplements and vitamins along with a strict gluten-free diet will be beneficial in the long run, and we have to protect our body and our mental health because any autoimmune deficiency can be very difficult to live with.